If I take PrEP, does that mean I don't need to use condoms anymore? You can still get HIV while taking PrEP. No prevention method is 100% effective, and PrEP should be combined with other safer sex practices. Will PrEP cause me to test false positive for HIV? PrEP use will not cause you to test false positive on an HIV antibody test the way an HIV vaccine might, because it doesn't rely on your immune system to prevent HIV infection. Can I drink while taking Truvada? While there are many medications that doctors recommend you do not drink alcohol while taking, alcohol and other recreational substances should not impact the efficacy of Truvada when used for PrEP. Won't using Truvada as PrEP mean that if I become positive in the future, I cannot use it for treatment? Not necessarily. It's important to realize that it isn't our bodies that become resistant to HIV medications, but the HIV virus itself. Research studies suggest that the greatest risk for HIV to become resistant to Truvada is if a person starts Truvada for PrEP when their body has already been infected with HIV. This can occur if someone starts taking PrEP without knowing that they are infected. This is why it is so important that your healthcare provider confirms your HIV negative status prior to starting your PrEP regimen and continues to monitor your HIV status closely throughout the time you are taking PrEP. Remember, PrEP is most effective when taken daily, so the best way to limit the chances of becoming HIV positive while taking Truvada is to take it exactly as prescribed. How much does PrEP cost? Without health insurance, the cost associated with taking PrEP is around $13,000 per year. If you have insurance, it is likely that your insurance company will cover this cost for you. They may require co-payments or pre-authorization, however, so you should check with them before initiating a PrEP regimen. Isn't PrEP new? How do we know it's safe? Truvada is currently the only FDA-approved medication for use as PrEP and has actually been prescribed to treat HIV for nearly a decade. Therefore, we have considerable knowledge about long-term Truvada safety and can conclude that taking Truvada as PrEP is likely to be safe when taken under the supervision and regular monitoring of a healthcare provider. What is the difference between PrEP and PEP? PEP, or post-exposure prophylaxis, involves starting HIV medications shortly after being exposed to HIV within 72 hours and taking them for 28 days. PrEP involves taking HIV medications before, during, and after exposure. People who have used PEP or have ongoing risk may be good candidates for PrEP.